Good afternoon, everybody. Welcome to our last Board of Health meeting for the year. We are at quorum, so we're going to go ahead and get started. We do not have anybody at this point for privilege of the floor, so I will move forward to approval of the October 26 minutes. So if I could have a first and a second from someone. Got a first from Melissa, a second from Ed. Let Sue kind of get on board here. Hi, Sue. We're voting on the minutes from October. We've got a first from Melissa and a second from Ed as written. Any discussion on those? Okay, all in favor as written? All opposed? And abstentions. Okay, we've got one abstention and everyone else in favor. Okay, great, thanks. Before we start with the financial summary, Frank, did you want to just really quickly introduce Bill so that everyone knows sort of, or do you want me to wait until we get to the county attorney?
We can do it now, and then,
okay.
Bill and Jonathan can both say no report at the same time.
Okay.
And I'll turn this over to Jonathan in a second, but you may or may not be aware that Jonathan is going to be retiring here from the county shortly. And Bill Troy, who has been serving as Deputy County Attorney, I believe is his title, has been appointed by the legislature to succeed Jonathan as the next county attorney. And so therefore we'll also be serving as the attorney for the Board of Health. Jonathan and Bill, if you guys want to say anything.
Sure. To begin with, I think it might be a good idea if people would introduce themselves. Bill could introduce himself, but so you can know who everybody is. And Bill will be attending the meetings, starting next month. Bill's been a deputy for how many years, Bill?
8, something like that.
Yeah, something like 8 years. He's well qualified. He's also represents several of the other municipalities in the county. But I think it would be good if people could introduce themselves and what their role is on the Board of Health, and that'll be helpful to Bill, I think.
Okay, great, thanks. Let's do that quickly before we go into the rest of the agenda, if that's okay with everybody. Frank already introduced me, Bill, just a few minutes ago, so I'll go ahead and work my way around the board first, and then we can also introduce the health department staff next. Samara, why don't we start with you?
I'm Samara Touchton. I'm a nurse practitioner at the hospital and at Reach Medical.
Great, thanks. Ed.
I forgot to turn off my mic and then I couldn't figure it out. I think I haven't been doing Zoom in a while. I'm Ed Kopel. I'm a physician at Cornell Health, and I've been here working at Cornell Health for about over 20 years now, and on the Board of Health for a good number of years. I'm not sure how many right now. 2 terms.
Yeah. Thank you. And Melissa?
Hi, I'm a pediatrician. I'm currently at Ithaca College, and I'm the medical director for a few of our Tompkins County school districts.
Thanks, Melissa. And Shauna?
Shauna Black. I am on the legislature. Hello, Bill.
And Sue?
Bill Troy. I'm Sue Merkel, and I've been teaching at Cornell microbiology for longer than Ed's been here.
Okay, great, thanks. And I think I hit all the board members. So let me shift to the health department staff now. I think you know Frank already. So Sam?
I do.
Hi, I'm Sam Hilson, and I work at the health department as Director of Health Promotion and Public Information Officer.
Great, thanks. And Brenda?
I'm Brenda Grinnell Crosby. We've met Bill. I'm the Public Health Administrator, Frank's deputy at Public Health.
Okay.
And Liz?
Hi again, Bill. We had the pleasure of having a pre-hearing meeting already, so Bill will be introduced.
And Bill number 2.
Good afternoon, everybody. I'm Dr. Claypack. I'm medical director of the health department. I've been medical director since 1991.
Thank you. And Deb? You're on
Sure.
mute, Deb.
Sorry. Good morning. I'm Debbie Thomas. I'm the Director of Children with Special Care Needs.
And Karen, do you want to come and introduce yourself? I can't. Okay.
I'm Corinne Palazzo, and I'm the administrative assistant. I take the minutes.
Great, thanks. And then the other person for introductions is Harmony.
Hi, Bill, and congratulations. I'm Harmony Ayers Friedlander, the Deputy Commissioner for Mental Health, and I believe we have a meeting set up soon, so I'll get to know you a little bit more.
There you go. Thank you.
So I think I got everybody. Did I miss anybody? Okay. So that's us, Bill. Welcome to the group.
Thank you. Look forward to it.
All right, so let's go ahead with the financial summary. Brenda.
The financial summary for October was included in your packet. I could actually probably run November now, but have not done so. I would dare say that while the dollars may have changed, the same narrative will probably apply. We are still juggling all of the COVID expenses and including the sampling costs that are driving up the 4010 account and making us look like we're way over budget. The ELC school grant, another modification has been sent in. I just emailed them to find out if it has been moved on to HRI for final processing. That's funding that will pay BOCES that assist the schools in their testing endeavors related to COVID. And I didn't comment on our Public Health Fellows grant. We have answered a series of questions related to our submission there, and we're hoping for approval on that grant and contract shortly so that we can start hiring our fellows. We're expecting 6 undergraduate level fellows, 1 graduate fellow, and a coordinator. So the addition of 8 staff for a period of approximately 2 years.
And Brenda, did you already hire for those, or you have to wait until you get the funding?
We have to wait until we're approved and have a contract for the funding. Okay. We are currently recruiting for the coordinator.
Any other questions for Brenda? All right, Frank, let's go ahead and move to your administrative report.
Sure, thanks, Christina. And just to say a few words about Jonathan too, as he is leaving. I believe this will be his last meeting with us. He has been the board attorney as long as I've been with the county, which is over 10 years now. And he's always been there to help guide through some very challenging situations that we've gotten into. And I know we always joke about his no report, but that's not a reflection of the work that Jonathan does for the department and for the board. And I just wanted to publicly thank him for his years of service to both the county and the Board of Health. We will certainly miss him. It's getting on to the business of the day. COVID is most of what's been taking up my time and CHS. I'll let Claire talk about the disease side of things. On the vaccine front, we've been spending much of the last month doing vaccine clinics for children 5 to 11 years of age. We have successfully vaccinated almost 2,300 children, and by Friday that will be fully vaccinated, meaning having 2 doses on board. Obviously they still have 2 weeks post that second dose before they're considered fully vaccinated, but our current county numbers, our first dose for that group is about 47%, second dose is about 36%. The state average for first dose is about 20%. So we have more kids percentage-wise with 2 doses than the state average for 1 dose. So we've been pretty successful to date and at least getting that process started. those numbers are still under 50%. So we've got some work to do to get more children in that age group vaccinated. And we'd like to see those percentages in the 70 and 80, like they are for the other age groups that are already eligible. To that end, we're working with our school districts, hoping to have a couple of first dose clinics scheduled next week out at the school districts to get that process started. And then beginning in January, we'll offer it to the rest of the districts that we aren't able to achieve next week. We're also planning for this Saturday a large-scale Moderna booster clinic. We have capacity for about 1,000 appointments that we're hoping to complete on Saturday. The finishing touches are going on that. A press release will likely go out later today with the registration links for booster doses. It's not something that we're going to be able to do continually because of capacity issues. But my hope is that by doing this one large clinic, we'll be able to clean up some of the backlog that has created the scarcity of appointments here in the county. It is difficult to find an appointment, and if you do, it's generally several weeks out into the future. So hopefully this will help get a lot of folks that want to be boosted, and allow the system to kind of right itself moving forward. There are appointments available in counties surrounding us. So I think that tells us two things. One, there are some appointments available if folks are willing and able to travel, but that our demand is good. I think the reason our appointments are filled up is because our community wants to get those booster doses. And so that's a good sign. So hopefully by creating this availability on Saturday, we'll get a lot of those folks that are interested an opportunity. So once we get through this weekend and then those first dose clinics at the end of next week, we're going to be taking about a 2-week hiatus on doing vaccines. And that really is a capacity issue. We need to be able to give people some time off during the holiday season. The students are going to be away from school, so it's not going to be really conducive for us to be doing them at the schools. So we're just going to take that time to regroup, give ourselves a little bit of a breath, and then we'll restart again in January. But lots of vaccine work going on in the community. I think that's really the county budget was fully approved at the legislature's last meeting. So the OTRs that we presented were all included and funded for 2022. And so the team here is looking at those now and beginning the steps to implement them when 2022 begins on January 1. And I think that's all that I have, Christina, right now.
Okay, great. Thank you. Any questions for Frank? Okay, Sam, health promotion.
Hi. So just to add to my report, the Healthy Neighborhoods program, which is a grant through New York State, was the contract was extended just recently and for the year, and it goes through March. So, so we're happy to get some official news on that, and we will be doing more visits and purchasing of home safety products in 2022. We're also getting ready to post a position that was approved in the budget, which will be part-time in Healthy Neighborhoods program and part-time in the Advancing Tobacco-Free Communities grant. And so that position is the title is Health Educator. So we will be, I'm hoping to post that by the end of this week and hire in January. And then just briefly about our strategic plan implementation, we are still underway with our cross-functional staff teams, and we currently have an RFP out to hire a branding development consultant for the new year as well, who will assist with new logo for the integrated department between mental health and public health, and also the new name for the organization. So that is underway, and we hope to get all of our proposals back next week and review them. So that's it for right now. Thanks.
Great, thanks, Sam. Any questions for Sam? Hey, Dr. Claypack.
Well, good afternoon again to everybody on a cold day. Cold day and driving everybody indoors. So as we see these rising cases that we have, you have to remember there are a lot of different factors for that. And crowding and moving indoors is certainly one of the driving factors. Some good news, from my point of view, and on a different subject other than COVID, is that since I drafted my board report, there was the announcement in New York City of 2 supervised injection or consumption facilities for the prevention of opioid overdose, for the provision of harm reduction, and for the ability to establish long-term relationships with individuals who have substance use disorder in order to help move them into treatment when they desire it, and to provide and identify those who need various types of social services. There's, of course, a dovetail over to COVID, because if you're inadequately housed or homeless, you're at a much higher risk of contracting COVID and other infectious diseases as well. What this means, excuse me, in the medium run, I should say, I guess, over the next couple of years, is I would guess, without knowing details, that the outcomes of these 2 New York City facilities will be watched very carefully. It appears as though they will be tolerated by the federal government, that nothing legally has changed with regard to the federal government's official stance about facilities such as this. But it appears as though they will be allowed to carry out this real world demonstration as to whether the global data about these types of facilities is also realized in the United States. The global data, as I've reported to the board some time ago now, is favorable, and we'll see if it's replicated in the very urban environment of New York City. And then from there, what New York State decides to do from there will be an interesting story, and we'll all need to stay tuned to. On a different subject, with regard to THC, or tetrahydrocannabinol, that substance which was the legislature legalized for recreational use last legislative session, the Cannabis Control Board has become constituted by the governor as of about 6 weeks or so ago. It recently put out some rules and regulations with regard to hemp cannabinoids. This is not the same thing as THC. These are products that are already being marketed in the state of New York, but lacked regulation. The rules and regulations that the Cannabis Control Board are putting out is to seek to achieve some safety and uniformity in the production and marketing. These are products that do not contain significant amounts of THC. They're defined as having less than 0.1% of THC in their makeup. So what will follow yet will be regulations and rules related to THC itself. And those will pertain to the manufacturer, the packaging, the appearance, the labeling, the quality control, the advertising, all aspects of marketing of THC, which will be, I think, very important for us in public health because THC, which is the active ingredient, principally the principal active ingredient that causes the high that people seek recreationally, is also much more prone to adverse impacts of overdosing, either by misunderstanding how dosing operates for the user, by accidental ingestion by children and adolescents when the products are accidentally taken thinking they're a food substance or a candy. So we will be very interested. We'll be very interested also, of course, in the traffic safety implications, which remain to be seen. So this will probably follow in the coming weeks, I would guess. As you know, there is a deadline at this point for municipalities with regard to THC only, not to hemp cannabinoids and not to medical marijuana. But for THC, by December 31st, villages and cities need to decide whether they're going to opt in or opt out of retail sales and also consumption locations. If they opt out, they can choose to opt back in at a later point. If they opt in, they cannot change their mind. They are locked into that position. It's a bit of an awkward situation at this time, I think, for you if you're on a town board or if you're on a village or a city board, because the rules and regulations for THC aren't out there for you to scrutinize. The most current report I've seen about Tompkins County indicate that there are still quite a few communities that have yet to decide, but there are a sizable number who have decided to opt out at this point. And I think probably driven largely by the fact that the Cannabis Control Board got constituted relatively late in the game, and the rules and regulations aren't there for them to scrutinize. So we shall see how this develops, and we'll probably have something more to tell you in January. Of course, what we're all thinking about is this variant of Omicron. And I want to urge everyone, as I'm sure you have read and are aware of, that far too little is known about this variant. And when we think back to when Delta first began, when we think back to when the UK variant first began, it took a bit of time before we knew scientifically the details about this, about the variants. This is no different with Omicron. Whatever you read in the media, whatever speculation that people from South Africa are making, et cetera, it's based on their best guesses at this point. And we'll need to wait another few weeks before we can have firmer data to go on. As you know, the time course from infection to serious disease, hospitalization, and unfortunately, when it occurs, death, there is a delay period. It takes about 2 or 3 weeks for the disease of coronavirus to express itself fully. So we are too early in the experience with Omicron to see it all play out. And therefore the data cannot be gathered until it actually is experienced. So I would just urge the public to, as in the words of many people, don't panic, but hearken back to what you know works. And that's using masks in a very prudent way, very consciously using them, distancing, staying home if you're sick, getting tested if you think you have an exposure or you think you have a symptom that may be coronavirus. We do have a little bit of data locally as of the weekend. Actually, I guess the end of last week. I can say that to our knowledge, there have been no Omicron variant detected within our region. That's a good news, but it doesn't mean that it's not here necessarily. It may be that we just haven't detected it yet. But we are scrutinizing things and trying to stay abreast of this. However, for the public, to the best of our knowledge at this point, whether it's Omicron or a Delta or some other variant, it does not have an impact on your treatment or what you should do. So all the good advice you've gotten in many venues over these past months still pertains. For our local cases, Claire will update you more fully, I'm sure. I just want to caution you that also for our local surge in cases, we're still in this interval period before you'd usually expect to see hospitalizations rise. We're very fortunate that our hospitalizations are really in about 6 to 8 range. Many of them are not Tompkins County residents. We hold our breath for this next week or two, hoping that we don't see a significant rise back to the bad old days of last winter and in the summer. And that, in fact, it will can serve to prove that vaccination keeps you out of the hospital. We have high vaccination levels, thanks to all the good work of all of our department and all of our partners in the community. We're hoping that as we go through this experience, that we'll see evidence that our levels of vaccination are keeping our Tompkins County residents out of the hospital. On influenza, you've seen data that shows a very high level of cases in Tompkins County. Last week, I looked into this in more detail and polled about 4 of the primary care practices in our county and higher education. I think it's quite clear that our number of cases of influenza that are, these are laboratory confirmed cases. So these are a subset of all influenza cases. These are cases that a lab test was done and it was the result was reported to the state either directly by the practitioner or through the laboratory reporting system. And I think the conclusion is clear that the vast majority of the cases being reported have come from higher education. That isn't a disparaging remark about higher education. It's simply a matter of fact statement. And certainly many proactive things are done at the higher education level to mitigate further cases. It points out for the general public, not just higher education, influenza vaccination is important and vaccine is available. And so I want to take this point to urge the public to become vaccinated. It by no means is too late. And so you'd be well advised. You certainly don't want to come down with influenza and worry that you have COVID. And that you would have to do because the symptoms are so similar. So become vaccinated, please. So with that, I thank you, Christina. And if there are any questions, I'd be pleased to answer them.
I think Melissa has one for you.
Hi, Dr. Claypack. Is there any talk about mandating an indoor mask mandate again? Because I know the hospitals around us are filling up and we are seeing a lot of flu up here. So I think the mandate would help keep the numbers down in the hospital, keep the flu numbers down, and help with COVID.
Well, certainly the the health department, our health department, has for many, many months had an advisory advising indoor masking. So there's no change in that. If you're asking about a state level mandate, I believe the governor has said that she doesn't anticipate any further mandates on a statewide basis at this time, but that she is keeping an open mind and is concerned about situations. But no, I don't see anything coming soon about that.
And can we, as a county, I know we can't be less strict than the state, but can we be more strict and have a mask mandate for the county? Or is that not allowed?
I can let Frank
It's a hard
address
one.
even in more detail because he can be more explicit about it. But yes, you're certainly right that we cannot undercut what the state advises, and we do have some ability to be more strict. But I don't know, perhaps Frank, do you want to address that?
Yeah, so the county would have the authority to be more restrictive. I get this question a lot about should we be doing more, such as having additional mandates. And I don't think our situation yet reflects a need for anything different. We, as Dr. Claypack alluded to, our hospitalization rates still remain low. We do still have a lag of a couple of weeks on that with this recent bump up, and we've seen a significant increase in cases for going on 6 weeks now with minimal impact on the number of people in the hospital. And as Dr. Claypack said, we do have an advisory in place for indoor mask wearing for everyone. The only difference between that and a mandate is enforcement. And enforcing a mask mandate, in my opinion, would be not a successful use of what are already very limited resources. And I think to a degree, it would also have a negative impact on our long-term goals, which is trying to get more vaccine hesitant people vaccinated. I think that the tenor of the conversation around the pandemic is such that the more the draconian measures as they're being described are implemented again, the more people are going to dig in on their opposition to what we're asking from a public health perspective. So, it is my position that we're not in a place where any additional required public health intervention should be put in place. We do plan to increase our public information over the next couple of weeks around mask wearing and vaccinations and gatherings and protecting the most vulnerable, our seniors and those that are immunocompromised. All of that is coming and is in the works. It's difficult. It's not the right word. Mandates are challenging, right? In that there's the only difference between recommending and mandating is enforcement. And understanding what we went through, even when everyone was willing on mask enforcement, it was not easy. And it really created challenges both for public health, as well as our law enforcement and anyone else that we engaged in those efforts. And what we found as a community, I think, is encouraging people to do the right thing through communication about why it's important and how it's going to help has been our most successful tools. And that's what we're spending our resources on at the moment, is those types of activities.
You certainly do also see individual businesses exercising their right to post a sign on their door and say, all people are required to mask who enter, and others who will say, a variation on a theme. So businesses also have their flexibility.
Okay, other questions or comments on that topic?
Sorry.
Yes, Lisa.
I guess the only other comment is, I know Frank, we spoke about it, but I'm wondering if there could be some information sent out to the community that talks about the mild symptoms that you get when you're vaccinated and potentially have COVID, because many people seem a little bit confused on that. So they'll say, oh, it's just my allergies. Oh, it's, I don't have a fever. Oh, I'm back. Yeah. So everyone who I've tested positive has thought it was just a cold or their allergies. And I don't think they fully understand, or some people don't fully understand that that's the way most of the COVID cases are going to present at this point.
Yeah, a component of all of our messaging talks about staying home if you have symptoms, but we can certainly, Sam and the PIO group can take that feedback and see if there's different language that we can use.
Well, and I think part of that too is that it might be worthwhile to almost say something similar, but in a different way, because we've been using the same language for so long that I think that it's not resonating the way it used to. So I think that is part of the feedback as well. Okay, other thoughts or questions for Dr. Claypack for any of these topics? Okay, Claire, we're going to move on to you. And Claire, you joined just a little bit late, and we had done a introduction of everybody for Bill Troy. And so I don't know if you've met him already, but could you introduce yourself first before you do your report, please?
Hi, yeah, thanks, Christina. Hi, I'm Claire Espy. I'm the Community Health Services Director and joined in December. So it's been just a year that I've been in this role. New to Tompkins County at the time, and feel like I'm just rolling with the changing context, and really impressed with everyone here, and yeah, the quality of services and the care that everyone puts into keeping the community healthy and promoting health. So it's a pleasure to meet you. So it's always interesting. These reports are, there's a delay. So we were covering the month of October in this Board of Health report. No significant updates on that report, but maybe just a snapshot to complete what Frank, Sam, and Dr. Claypack had discussed with respect to the COVID surveillance. So at the moment, we are seeing cases fluctuating around 40 to 80 cases a day, I would say. We did have a high of 100 this weekend, and mostly these are a function of when people are getting tested. We are also looking at the kind of total number of people that we consider to be infectious that are in isolation. At the moment, it's about 340 cases. So these are high volumes. We're seeing most of these, that there may have been spread from gatherings, from local domestic travel over the holidays. Still a lot of family household exposures, and some increases lately in higher education, both Cornell and Ithaca. And so we're tracking that with them and their teams. We have pulled in additional support, and we're working particularly with the state to ensure that our approach is sustainable through the peaks that we see. We have both staffing from the New York State Department of Health through the virtual call center, and also we've drawn on some county helpers. I'd like to give a shout out to Karen, who's devoted time over the holidays and weekends in addition to her work, just to help us fill the gaps. That is not a sustainable approach, we recognize. So we are streamlining our processes and prioritizing, and we're getting the work done. So my sense is the team is really doing an excellent job. To the point about communication and what we want people to know and how to act on it, I would say helping us to get through the periods with really higher volume. We're working with leaders in the community that enable them to respond quickly and act preemptively on a positive results even before the health department is able to reach them. So to that effect, we're asking that people who are experiencing symptoms of COVID, or if they're exposed, that they get tested with a PCR test. And if they're symptomatic, we want them to stay home and away from any others in the household, wait till their tests come back. And if they do test positive, that they should isolate and contact the health department. Home tests, we've seen a lot of home tests lately, and they should be followed up with a PCR ideally. And we have had a lot of folks contacting us when they get a positive home test, and we can help them get appointments. And in cases where they have a known exposure, they're symptomatic, and it's been more than 48 hours since they're positive at home test, we can act on that and begin the investigation. So yeah, I think that kind of sums it up for where we are with COVID. Our other services are continuing. So we are taking Moms Plus clients, which is great for the maternal health services. In other news, we have one of our community health nurses, longstanding public servant, Nanette, will be retiring at the end of the month, and we'll be recruiting for her replacements to be focused on communicable diseases. The WIC program is steady. They've had increased clientele and enrollment, higher numbers than they've seen in a very long time. And the RFA for the 2023 5-year proposal came out today and will be a priority for the next 2 months. I think that's it.
Great. Thank you so much, Claire. Any questions? Yes, Ed.
Being a little bit of a zoonotic disease, I guess geek might be a better way of saying it. I was actually looking at the communicable disease report for the, and I've been actually watching this over the last several months, but a couple of months, but I can't help but noticing there another disease that is quietly increasing in numbers, and it's the anaplasmosis level numbers. And I was just want to make people aware of that. I was actually pretty surprised as that has come up this past year compared to other years. And it just shows that, we just don't want to let our guard down with things like Lyme disease and tick-borne diseases such as anaplasmosis. I thought that was it's just interesting to note that as we get lost in the COVID flu pandemic.
The last practitioner bulletin that I put out, I believe it was the last one, or maybe it was the one before that. I copied sections of the communicable disease report that you see before you and talked a bit about anaplasmosis and babesiosis. The surveillance that the state does annually, pretty much annually, where they choose a site in Tompkins County and then collect ticks from that site and then test those ticks for pathogens, tends to confirm a rise in those pathogens in those tick samples. Still, the vast minority of ticks are infected either with Lyme disease or with babesiosis or anaplasmosis. So that if you have a tick bite, it's not 100% that you've been infected with something.
Is that still on the order of about 35% ticks infected?
I think so. I can go back to my report, but
that's okay. That's all right.
Yeah, don't want to talk off the top of my head, but the important point for the public is that unfortunately, unlike Lyme disease, the time period between tick bite and the tick infecting you, if it's going to, is far shorter, so that you have less opportunity to recognize you have a tick on you, pull it off and not be infected. And the importance, therefore, is that the public be checking for ticks, but also as you're out and about, think of using those tick repellents and quickly checking yourself after being out. So that went out in a practitioner bulletin so as to make all practitioners aware. And I think certainly as we get into later winter, doing something not only online, but on babesiosis and anaplasmosis would be particularly appropriate. I hesitate a little bit to say later in winter because all it takes is for the temperature to rise into the mid to upper 30s and these ticks become active again. And so even in the winter, in the right situation, you can get a tick bite. But by and large, mostly what we deal with is warmer weather months.
I was also surprised about the babesia numbers, although they're much smaller, but still surprising.
I don't know if you've seen it at Cornell, but certainly when I talk to a few people in primary care, they say, "Oh yeah, I'm identifying anaplasmosis. I'm treating it. It's become a thing."
Thank you.
Thank you. Any other questions, comments before we move on? Okay, I think next we have Debbie and children with special healthcare needs.
Hi, nothing more to add to my report.
And then Jonathan/Bill. Jonathan, it's your last one. Make it a good one.
It's my last one. So no report, I think, would be consistent. No, I really have, been doing this for a long time. I always like the Board of Health meetings. They tend to be efficient and to the point. And, it's really been a pleasure to be part of it for a long time, from back when it was, in Biggs, till the new building, and now this on Zoom. Hopefully it'll go back to in person soon, though I'm not sure. The governor's rule allowing us to meet remotely only goes through mid-January, but I expect it may change again. Not sure about that, but it's been a great pleasure. And most of the work I do with the health department is obviously not at the Board of Health, but the Board of Health has always been a really interesting and pleasurable thing to attend and to learn, and I do learn from it, and that's not true of all committee meetings. So it's been a pleasure, and thanks for letting me be that.
Well, I wanted to echo what Frank said earlier, and thank you. Yes, a round of applause from all of us. Thank you so much for all the support that you've provided to the health department and Board of Health over the years. So thank you. And welcome, Bill. I don't know if you have anything that you wanted to add to the report, or you're good.
I'm good, other than to say the suspense will build to see if the report regime continues. But one other point with Dr. Klepak and the cannabis sales, you may all know this. A municipality is automatically, by operation of law, opting in if they do nothing. So you don't have to do anything to opt in. It's only if they want to opt out. They can opt out of, there's two parts, sale or consuming on site. You can choose one, but not the other. But basically, they're all in 100% unless they take steps to opt out.
And just to be clear, it does not apply to counties. I think most people know that, but just to be clear.
Thank you. Okay, any other final questions or comments for our attorneys? All right, Liz.
I have nothing to add to my report.
Okay, any questions for Liz on her report? Okay, let's move into our enforcement actions. The first one up is for Casablanca Pizzeria. Could I get a motion to approve as written? Need a first and a second.
Christina, is there a CSB report?
Oh, my apologies, Harmony. I skipped right over you. Thank you, Sue.
Actually, I was not able to attend our last meeting, so I'm going to defer to Frank on what happened because the meeting was just last night.
Yeah, it was last night, so I'll be able to remember this time. So much of it was around a pay increase to $15 an hour for some of the vocational programming that is supported by the state. So Elise Switzer, who works in that field at Cornell, who is also on the board, gave a presentation about that for the board. So there could be some awareness as that comes into play. We don't think it'll have much impact here in Tompkins County because most of the folks that are doing that type of work and programming are already receiving those types of wages. But for counties around us, it will be a fairly significant change. Other than that, we talked a good bit about COVID. And they had some conversation about board vacancies and subcommittee vacancies. So they are once again recruiting for both the board and their subcommittees. So we'll be working through SAM to get word out about those positions to try to recruit new participation. And that was it.
Great, thanks, Frank. Any follow-up on that from any board members? Okay, now we'll go to Casablanca Pizza. And looking for a motion as written. I have a first from Ed. Second from Melissa. Let's go ahead and open for discussion. Liz, I don't know if there's much to add to what's already in here that we need to understand.
No, this is a case of food being out of temperature in a cooler and a proposed $200 fine. The only thing I noted in the case summary is that it's a new owner as of August 4th, 2020, not 2021. But that's the quick overview.
Okay. Any other discussion on this? Okay, all in favor as written? I think that's unanimous. Okay. The next enforcement action, hold on, I just have to scroll down because I'm in the bottom and I have my agenda open, is related to Agava. So a motion to move forward is written, to approve is written. First from Ed, second from Sue. Again, open for discussion, although Liz, I don't know that there's much in addition to what's in here for us to understand, but please share if you think there's more that we need to discuss or understand. Any other discussion from other board members or questions? Okay, all in favor is written. All opposed? Oh, I think that was unanimous. Okay. Okay, third enforcement action is also somewhat similar with Ithaca Bakery. So related to mold on cheese. So motion to approve is written, a first from Samara, second from Sue. Liz, any additional discussion on this for us to understand?
I would just point out, this is a violation of Board of Health orders. We used the penalty calculation method that we brought to the board. I can't remember if it was 2019 or 20, well, when it was, but
it was 19. I think it's been almost a year and a half now, or 2 years. Yeah.
Yeah, we're just now really getting to implement it since we've been getting into real inspections again. So the $200 proposed penalty, there we look at the risk factors of the violation. That is violation of Board of Health orders, any previous enforcement actions due to critical violations, but then they also get credit or reductions in the proposed penalty based on how many inspections that they've had since the last enforcement action that did not have critical violations. So they had 2 inspections in 2019 without a critical violation and 1 in 2021. I think I have the dates right. So in case there was any question on the penalty.
Any other questions or discussion on this one? Okay, all in favor is written. All opposed and abstentions. Okay, Samara, did you vote?
All in favor.
Okay. So I think we were unanimous there too. Okay, now I know we have one more board item to talk about, but I just, for those folks who are scrolling through the packet, I just wanted to make sure you're aware that the dates for the future board meetings is the last page of your packet, to make sure that those are on your calendar. And I guess at this point, the January 25th meeting, whether that's in person or on Zoom, is still TBD based on what happens with the governor, correct, Frank? And you'll let us know?
Yeah, I think it runs to the 21st of January, the current.
I think we had
order.
this discussion the last time that it was, okay. So you,
Our plan will be to meet virtually if we
Okay.
are allowed to, and if we aren't, then we'll meet in the Rice Room at the health department.
okay, great. So virtually if we can, and then if we can't, then we'll be back at the Board of Health, right? Or I'm sorry, the Health Department. All right. Okay, Frank, I'll turn this over to you.
Sure, thanks, Christina. So we have 2 board members whose terms are ending on the 31st of this year, Sue Merkel and Ed Coppell. We've talked with both of them, and they are both interested in being reappointed and are eligible for such. So in the absence of really needing the nominating committee to meet, I'd like to propose to the board a recommendation for the legislature that both of them be reappointed.
And so Frank, you need us to vote on that?
Yeah, we need a
Okay,
motion.
so all in favor of that proposal?
You'll
Should we
need a
hide our eyes?
Yeah. What, Frank?
You'll need a motion first.
Okay, a motion on the proposal as to reappoint Sue and Ed. Okay, first from Melissa. Can I second it? Am I allowed to second it? I'll second it. Okay, any discussion? Okay, all in favor?
We vote?
What?
Probably should abstain. Okay, and then
I'll vote for Ed. How's that?
Okay. Should we do them separately then? Should I do Ed first and then Sue?
That probably makes sense.
Okay, so let's can we revise a motion to reappoint Ed to the Board of Health? I need a first on that. First from Melissa, second from Sue. All in favor? I'm sorry, any discussion on that?
Christina, could you make
All
this
in
more
favor.
painful?
I know, all in favor. So, okay, that's unanimous. Okay, I need a second motion to reappoint Sue Merkel to the Board of Health first. Okay, I have a first from Samara, a second from Ed. Any discussion on that? All in favor? All opposed and abstentions? Okay, so I think we're good, right? And we've covered all items on the agenda. There are no additional items I'm aware of. So I think we can go ahead and adjourn. Okay, everybody have a great holiday season. We will see you in January. And thank you for everything. And I hope everybody gets a chance to rest and take a little bit of a breath. Okay. Yes. Bye-bye, everybody.
Bye, everyone.